Good evening, everyone. We will be getting started momentarily. At this time, there is a pre-survey that is in the chat. We are asking that you take a minute to take the pre-survey. We'll be getting started in 2 minutes. Thank you so much for joining us tonight. I apologize for the host. It is BGLC, the Black Greek Letter Consortium. Zeta Phi Beta is a part of the BGLC. Thank you so much. Once again, I'm putting in the chat a pre-survey under organization. We are a part of the BGLC, Black Greek Letter Consortium. As we still have a few people joining, once again, there is a pre-survey in the chat. We are listed under the Black Greek Letter Consortium. We thank you for taking the time to take the pre-survey. All right, I have placed the survey in the chat for those that have just joined us. The organization is the Black Greek Letter Consortium. We thank you in advance for taking the pre-survey. So now we're going to go ahead and get started. Good evening. My name is Dr. Siobhan Chambers Williams. I serve as the National Co-Director for the All of Us program for Zeta Phi Beta Sorority Incorporated. We are really excited that you are joining us as we launch our Health is Wealth series. And to give you a little insight about the All of Us Research program, we're going to show a brief video to capture the essence of the program.
Not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better until now. Enter All of Us, the research program based on precision medicine. By gathering health data from 1 million people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. By becoming one of the first 1 million people to volunteer, you can help reshape the entire future of healthcare for generations to come. Sign up at joinallofus.org. The future of health begins with you.
All right, so as the video highlighted, the All of Us Research Program is an effort to bring together 1 million or more volunteers that reflect the diversity of the people living in the United States. The goal is for all volunteers to provide their health information of their choice for at least 10 years. The program is open to both people who identify as healthy and those that may be currently sick from all communities. The reason for the 1 million is that they would like to create a rich resource database that would not only help researchers, but scientists and doctors figure out medical breakthroughs, create individual prevention treatment, and most of all, give us, each of us, the individualized care that we deserve. At the end of today's presentation, we will share additional information about how to possibly sign up to get frequently questioned answered, as well as some of the target cities that HPOs are located. So without further ado, I would like to bring forth my director of the All of Us research program for Zeta Phi Beta Sorority, Sir Crystal Brown.
Good evening, everyone. I am Crystal R. Brown, the director for All of Us with Zeta Phi Beta Sorority Incorporated. I want to thank you for joining us tonight as we participate in the American Heart Month, which takes place all throughout February. Tonight, we're going to kick off a webinar series. As you know, our webinar series will take place each Monday in February, and our topic for tonight is Health is Wealth. So we want to make sure that we are talking about the health of the heart. And as we go through other topics in our future webinars, we will be discussing maternal health, mental health, as well as physical health. So I'm going to bring on our two panelists for tonight. We have with us Kimberly Morris-Dove and Janet Banks McElrath, the director and co-director for Zeta Phi Beta Zetas Have Heart. Kimberly Morris-Dove began her long road to becoming a healthcare provider by graduating from Lower Richland High School in Hopkins, South Carolina, where she participated in a nursing program at the high school. She began her collegiate years at the Valdosta State University in Georgia. She later transferred to the University of South Carolina in Columbia and earned her Bachelor's of Science in Biological Science, followed by a respiratory degree at the Midlands Technology College. She was awarded a scholarship from the South Carolina Society of Respiratory Care for an essay she submitted on nutrition and COPD patients. Later, Kimberly earned another Bachelor's of Science degree in Healthcare Management at South University, where she also stayed to earn her MBA in Healthcare Administration. She was also inducted into Delta Mu Delta Business Honor Society. Kimberly has always been fascinated with the respiratory system from an early age. She has been practicing respiratory care since 1996, working from several hospitals throughout her career to include Virginia, D.C., California, Florida, and South Carolina areas. She has worked in different settings such as ER, ICU, NICU, cardiovascular, labor delivery, and pediatrics. She is currently working with the Department of Veteran Affairs in Columbia, South Carolina. She enjoys helping people and has always held an interest in nutrition and health, where she has earned some certifications in these areas. Kimberly is a proud member of the finest organization in the world, Zeta Phi Beta Sorority Incorporated. She was inducted through Alpha Theta Chapter at Valdosta State University in the spring of 1991. Currently, she is a member of Beta Beta Zeta Chapter in Columbia, South Carolina. Kimberly is happily married to Christopher Dove and has two daughters, one whom is a Zeta, and two sons. Janet Banks McElrath has always had a passion to help others. As a youth, she worked as a candy striper with aspirations to become a nurse. She attended and received her diploma from Harper Hospital School of Nursing and received her license to practice as a registered nurse in 1977. She received her bachelor's degree in nursing in 2000 and a master's of art degree in healthcare administration in 2003. She worked in various capacities within the state of Michigan until all facilities were privatized. Upon leaving the state, she was offered and accepted the position to oversee Allied Health Department of Detroit Public Schools, supervising the district and contracted registered nurses, occupational therapists, and physical therapists. She remained there until 2011 when she retired. Currently, she is working in the community at Henry Ford Health Systems as the Faith Community Nurse Coordinator, working with over 40 congregations coordinating health and wellness programs. During her time with the Young Girls School and community, she desired to create a platform for advocacy and mentorship, Young Love, You and God, Ladies of Virtue and Excellence, created in 2007. It is a 501c3 multi-level mentoring and self-esteem program for girls. She is also a proud member of Zeta Phi Beta Sorority Incorporated, Beta Omicron Zeta Chapter in Detroit, Michigan. She currently serves on the national team as Zeta's Have Heart co-director. She is also a proud member of the nursing sorority Chi Eta Phi Sorority Incorporated, Lambda Chi Chapter, Detroit, Michigan, serving on the programs and projects, technology, and public relations committees. She is the proud mother of 4 children and 3 amazing grandchildren. Ladies and gentlemen, I present to you this evening Kimberly Morris-Dove and Janet Banks McElrath.
Good evening, everybody. I just wanted to also add that I have 2 children that are proud members of Zeta Phi Beta Sorority Incorporated and Phi Beta Sigma Fraternity. I wanted to also share that what we're going to talk about tonight is Have Faith in Heart, which is a program for Empowered to Serve. So right now I'm going to share my screen so that we can get started. All right. Have Faith in Heart, Empowered to Change. So Have Faith in Heart, we're going to discuss what is Empowered to Serve, the program topics and urgent community needs. We're going to talk about the health lesson, Have Faith in Heart. You're going to understand your risk and know the signs. Start your journey to better health. Join research, Go Red, and AHA's Go Red for Women's Movement, and closing thoughts, Your Voice Matters, and online resources. So with all of us, we're talking about research and involving in research. American Heart has the same goals as well. So what is Empowered to Serve? Empowered to Serve is a movement inspiring those who are passionate about driving change through health justice in their communities. We're catalysts for change, empowering the equity equation. So AHA's mission statement is to be relentless force for a world of longer, healthier lives. I just want to share my story. I am an Empowered to Serve ambassador, and I've been one for quite a while. But what really moved me was that a lot of our people do not know what they need to do to save their own lives. Me being a person, I consider myself very healthy. I exercise, I eat right, but in 2018, I had to have surgery on my back. I had some back injuries. And in the process of becoming medically clear for that surgery, I had to have EKG. And as I was talking to my doctor, he asked me the question, and I told him, I said, I have my heart races. It races up to 200 on, sometimes. And I just sit down and I try and calm myself. And he said, that's not normal. I said, well, I just look at it as anxiety. Well, what he did when they did a heart monitor on me and they found out that I had supraventricular tachycardia. And that's a condition that if I did not take care of myself, I could drop dead. But, you know, a lot of times we kind of look over some of these symptoms and we say, you know, it'll go away, it'll go away. So I wanted to be able to share with people that, you know, you have to really pay attention to your body. So Go Red for Women is a platform designed to increase women's heart health awareness, serve as a catalyst for change to improve the lives of women globally. For over 16 years, Go Red for Women has provided a platform for women to come together, raise awareness, fund life-saving research, and advocate for change and improve lives of women all over. Go Red offers women the opportunity to learn about heart disease and stroke, access the latest healthy living tips to reduce their risk and improve their overall well-being. Participate in research, as we were talking about, and advocacy, share their stories, and get involved in their communities. It's no longer just about wearing red. It's no longer just about sharing heart health. It's all about women making a commitment to stand together with Go Red and take charge of their own heart health, as well as the health of others. Did you know that cardiovascular disease is the #1 killer of women, claiming the lives of 1 in 3 women? Cardiovascular disease kills more women than all forms of cancer combined. About 4 million stroke survivors alive today are women. Over 40%, about 43% of Hispanic adult women aged 20 have cardiovascular disease. Cardiovascular disease claims the life of more Black women than all forms of cancer, accidents, assaults, and Alzheimer's disease combined. So I want to ask the question, how many of you have been personally affected by heart disease or stroke, or have a family member who has? If you could raise your hand in the chat. I can't see it, so if anybody is out there can just let me know if there is a plethora of people raising their hands right now. So if you want to look in the chat and see, heart disease and stroke are affecting our community at an alarming rate. So we need to understand the risks. The good news is about 80% of cardiac events can be prevented if women make the right choice for their hearts, including you want to move more. You know, I know it's kind of difficult to be moving around because of COVID. We're in the house, but there are things that you could do in the house that you could do outside, you know, up and down the stairs, going to the dryer to pull out one piece at a time and walking across the room. You want to move more. Make sure that you consciously have breaks. You want to eat smart. During this period of time, I've heard that a lot of people do a lot of shopping with ship shopping and meal planning. You can really start planning on how to eat smart. There's so many recipes, there's so many chefs. There are a lot of people that are out here telling you what you can eat. So that would help you improve your health. And managing your blood pressure. We all should have a blood pressure monitor. How many of you have blood pressure monitors where you can monitor your blood pressure at home? That helps your doctor. You should always at least take your blood pressure at least twice a month. And you know, there are websites for the American Heart Association on how to effectively take your blood pressure. You know, you're not going to take your blood pressure after you've been running up and down the street or after you've done a lot of exercise. You want to make sure that you have an empty bladder when you take your blood pressure. That makes a difference. You want to make sure you've rested about 5 minutes before you take your blood pressure. There are a lot of things that you should do before you take your blood pressure to make sure that you get an accurate blood pressure. So I want you to think about that. Make sure that just because you think you don't have high blood pressure, You need to get out there and to know what your blood pressure is. You need to advocate for yourself. You want to understand your risk. There are risk factors that you can control, and there are risk factors that you can't control. But the ones that you can control, number one is smoking. You want to stop smoking if you're smoking. That increases your risk. You can control your high blood pressure. Like I gave you some examples of taking your blood pressure, but there are things that you can do to reverse that. High cholesterol. There are things that you can do to reverse high cholesterol. Being overweight or obese. There are things you can do to reverse being overweight and obese. High blood sugar. There are things that you can do to lower your blood sugar. Lack of physical activity. You can become active. So these are things that you can control. Things you can't control is your age. You know, I'm forever 25, but really my body is 65. So, you know, I have to embrace that age, but I can't control that. Race and ethnicity. I'm a Black woman. I'm gonna be a Black woman. I'm a female. Family history. You have to listen to your family and make sure that you get these stories. You know, you hear so-and-so had a heart attack in your family. How many other people had heart attacks? How many other people have cancer? These things are really important. You know, there's a risk factor you can't control, but you need to know. Previous heart attack or stroke. Like I said, these are risk factors that you cannot control. It's important, though, that you talk with your healthcare provider about these risk factors and have your family history when you talk to the doctor. I know that when you go in the office, they ask you, they have all of these questions. Your family member, do they have cancer? Do they have thyroid problems? Do they have this? Know what your family history is. It's very important. You need to know your numbers. There are 4 numbers that all women should know to take control of their heart health. 1 is their total cholesterol. 2 is their blood pressure. 3 is blood sugar, and your BMI, your body mass index. Prevention is the key to changing your outcomes. You want to take control of your health now by knowing your numbers. And like I said before, it's important to see your healthcare provider to learn your numbers and work with them to reduce your risk factors. So you need to talk to them as to what your norms, what your numbers are. You don't go by anybody else's number. There are normal ranges, but you know, sometimes there are differences in what would be normal for you. Whereas my normal blood pressure would be 120 over 80, but if it went up to 130 over 90, I would be concerned, you know. So there's a difference in some numbers. And in the packet, hopefully we'll be able to share. There are some references, handouts that talks about knowing your numbers. So hopefully we'll be able to share that. I'm not sure. Okay. Did you know the warning signs? Did you know women are having heart attacks? Having heart attacks may wait more than 30% longer than men from the moment they begin experiencing symptoms from the time they arrive at the hospital. Think about that. Women are less likely than men to receive bystander CPR. Wonder why? Female heart attack patients may have better outcomes when treated by female physicians. You know, disparities persist when it comes to symptom recognition, treatment times, and even life-saving support measures. So, like I said, there is a reference handout that we have about the warning signs of a heart attack and strokes. It's interesting reading. Heart attack. Some heart attacks are sudden and intense, but most of them start slowly with mild pain or discomfort. Following are some of the signs that can mean a heart attack is happening. And if you have any of the signs, don't wait, call 911 and go to the hospital right away. Besides knowing your risk and how to manage it, it's important to know the warning signs, like I said, of a stroke and a heart attack. You should know it, get help right away, either for yourself or somebody close to you. You know, it's easy to say, oh, I'll feel better in a minute. I'll be fine. You don't want to take that chance when it comes to your heart. So here are some of the signs. Heart attack warning signs. An uncomfortable pressure, squeezing, fullness or pain in the center of your chest. You know, you may think it's indigestion. Pain or discomfort in one or both arms, the back, the neck, the jaw, or the stomach. You wouldn't think that that would be a sign of a heart attack, would you? Shortness of breath with or without chest discomfort. Other signs such as breaking out in a cold sweat, nausea, or lightheadedness. As with men, women, most common heart attack symptoms is chest pain or discomfort. But women are somewhat more likely than men to experience some of the other common symptoms, particularly short of breath, nausea and vomiting, and back or jaw pain. Okay, so we're going to talk about stroke too. Stroke warning signs. Warning signs of stroke include a sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion or trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness or loss of balance or coordination, sudden severe headache with no known cause. And these letters, the acronym FAST, is an easy way to recognize and respond to the warning signs of a stroke. So the letters stand for F, face drooping. You can see, I've actually seen a person experiencing a stroke. You can actually see it looks like it's drooping on one side. Arm weakness, difficulty speaking, and T, time to call 911. People don't recognize that they're having a stroke. Usually it's usually somebody else that can see it and identify it. So stroke, like a heart attack, is a medical emergency. And when you or someone you know is having any of these symptoms, you want to call 911 right away. Get to the hospital. Also, it's important to note the time when the symptoms appeared. They have a medication, a clot buster drug that can be given within 3 to 4.5 hours at the start of the symptoms. And that may improve the chances of getting better faster. So you want to record the time too, because that makes a big difference in recovery. Okay, let's see. Okay, now I'm going to turn it over to Kim. More stuff.
Good evening again. I'm Kimberly Morris Dove, and I'm going to begin with point two, Journey to Better Health. It says, did you know that only 1 in 5 U.S. women is getting the recommended amount of physical activity under federal guidelines? And you know what the number one excuse is? Time constraint. Associated with fulfilling several roles such as employee, caregiver, spouse, and parent, and other responsibilities. Did you know about 50 million women have hypertension in the U.S. due to unhealthy lifestyle choices such as not getting enough physical activity? Did you know about 45% of US deaths are caused by heart disease, stroke, type 2 diabetes, are due to poor dietary habits, basic risk factors that we can control, as we saw in the earlier slides. Next slide, please. Journey to Better Health. That's why the American Heart Association has launched the Journey to Better Health. This program provides you the opportunity to learn to move more. A good starting point is at least 50 minutes a week. But if you don't have time to sweat the numbers, just move. By parking further away, not so close to the store. If you just move by taking the stairs instead of getting on that elevator. If you just move more and take 10 minutes out of your lunchtime to get moving. Whatever it is, just move more. Next, eat smart. Eating healthy doesn't have to be. No, go back to the other slide, please. Eating smart doesn't have to be. Okay. Eating healthy doesn't have to mean dieting or giving up, our foods that we love. You can learn to get rid of the junk by giving our body more nutrients, fuels it needs. You can add more vegetables to your diet. You can cut out those lean meats or fat meats for the lean meats. You can cut out processed foods. Just eat smart. Manage your blood pressure. And that can be done by fighting back, knowing your numbers, and making changes that matter. You can choose 1, 2, or all 3 paths. Each path of the journey is Better Health offers a step-by-step blueprint to help make the heart healthy habits a smart part of your daily routine. To learn more at goredforwomen.org/journey. Next slide, please. The American Heart Association, Go Red, Women Movement, and Verily Project Baseline have joined forces to launch Research Go Red, an initiative calling on women across the United States to contribute to health research. Research Goes Red to empower women to contribute to health research to collectively unlock the power of science to find ways to treat, beat, and prevent heart disease in women. By joining Research Go Red, you can choose to contribute through clinical research, surveys, focus groups, and more. But be the first to know when the studies are matching your preference opened. Test new technology to help those to shape the future of disease management and care. By joining Research Go Red, you can get exclusive, up-to-date, and that should be through leaders and community events. Ultimately, learn about your own health and help improve health of all. Join at projectbaseline.com/GoRed. And as Janet stated before, we should have those handouts available to you, that link, hopefully after this presentation. Next slide, please. Next here, we'll have a short video. Let's take a listen.
What would I do if I had more time?
Wow.
If I had more time, I'd call my grandma back. I miss her.
I'd go straight to the studio and dance my little heart out.
I would take up the guitar again because I have always wanted to be a rock star.
I would love to spend more time laughing.
I'd empower women to move.
I would do more of what I want to do and less of what I have to do.
If I had more time, I'd give it all to her.
If I had more time.
If I had more time.
If I had more time.
In 2008, at the age of 37, I suffered a heart attack. And I never saw it coming.
At 10, I was diagnosed with dilated cardiomyopathy, and at 22, I had a heart transplant.
Thanks to research funded by the American Heart Association,
so many of us have been given more time.
More time with our families, more time with our dreams, and more time to accomplish the things that cardiovascular disease tried to take from us.
And we're not going anywhere.
Together with the American Heart Association, we are empowering women to beat heart disease and stroke by giving them more time to do amazing things. Next slide, please. Okay. I encourage you to join the American Heart Association Go Red for Women movement to raise awareness, inspire action, and to save more lives. By going red for women, you are uniting with missions to prevent heart disease and stroke in women. You have also have access to the information and tools you need to save lives, including your own, and those of your mothers, sisters, aunts, daughters, grandmothers, and best friends. You can start your membership by fulfilling out the brief registration form online on goredforwomen.org. Make the Go Red healthy behavior commitment today. Your voice matters. Thank you for joining us this evening. Each of us have the power to make a difference in our community. By joining the American Heart Association, You're the Cure program, you can be among the first to know when major policies, initiatives pass, or when your help is needed to advocate for an issue. Text EMPOWER to 46839 to join today. Next slide, please. Use your voice to create healthier communities. I encourage everyone to be active in the Empower to Serve movement. Become a part of the Empower service and learn how to embrace a lifestyle of health. I invite you to come and Empower to Serve health lessons. Next slide, please. We are empowered to serve our communities, serve our health. Next slide, please. Wrap up. We appreciate your thoughts. Again, thank you for coming, but before we close, I would like to mention a little something about our initiative, Zeta Have Heart. Here's our lovely logo. Go back. Zeta Have Heart is an initiative that was started on our 24th International President, Mary Bro Wright. It was a 90-day health journey. Under our current president, Valerie Hollingsworth Baker, she has extended it and is flourished into a 24-hour, 7 days a week self-care program. Next slide. Okay, our mission statement: to improve the health and well-being and quality of life of all Zetas and affiliates by empowering people to promote and model positive attitudes and behaviors along through a lifelong commitment to health wellness through wellness audit, needed assessment, program design, implementation, service, and communication. Our vision is to create and sustain a healthy community culture that educates, motivates, empowers Zeta Phi Beta sorority and corporate and its affiliates. Next slide, please. Our program goals are to establish communication screens of promotion of the Zeta Have Heart brand, partner with the program, establish Zeta brand to link programs and partnerships, collaborate with other organizations, healthcare providers for health and wellness related service for assessment, screening, and diagnostic testing. Collaborate with providers of health services for mentoring, coaching, seminars, and workshops. Next slide, please. Here are some of the programs that we have. Here's our toolkit here and the shirts that we'll be proudly wearing this Friday to promote heart health awareness. Next slide, please. And here's our contact information. If you have any questions or concerns, you can always email us. Next slide, please. And thank you again for coming. And we would like to take time and answer any questions at this point.
Thank you so much, Sora Banks McElrath and Sora Morris Dove, for a very informative session. Before, there was a question placed earlier during Sora Banks' presentation, and the individual mentioned that she sometimes have exposure to a lot of heat, and she sometimes gets confused occasionally and has some chest pain. And so she wanted to know, is that a possible sign of a stroke?
Well, I would not want to diagnose it, but I would say that would be of a concern that you should call your doctor and let your doctor know, let your physician know what symptoms that you have. It could be a matter of you might be dehydrated. You know, it could be quite a few things that's going on, but know that that is not normal. And if it's not normal, you need to seek help, assistance from your physician or primary care.
Thank you so much. And then Sora Morris Dove, a Sora in the chat wants to know, how can you order a shirt? So if you want to place that in the chat, you can, or I'm sure that's going to be coming out via the protocol chain as well.
Matter of fact, it had already went out. Matter of fact, if you're trying to get it for Friday, you're a little too late for that, but you can always order the shirt, and the vendor is Greek Sneak, and he's selling a lot of our brand. Matter of fact, the original shirt is in the blue, our Zeta blue, but for this month, we have asked him to do it in red just to support women's health.
Thank you so much. We have a really great question from Kara. Do you have suggestions on how to broker the conversation on family health history without seeming to invade privacy?
Oh, there are a lot of ways to actually that you can do that. I'll just offer some suggestions from what I've done. During family reunions, have a special speaker come in, or have somebody to talk about you know, heart disease or cancer to come in and start the conversation off with that. One year, my family, when we have our family reunion, we have little skits. And one of the skits that we did, I wanted to be able to, this is off the heart health, but it does apply. We wanted to talk about what would happen with advanced directives. What would you do if something was to happen to me? And we were sitting around the table, and each one of my children, I asked them, I said, so if I was to get sick, what would you do? What would you do? Would you honor my wishes? My daughter said, no, I'll put you in the best nursing home there is. And my other son said, well, you know, you've always been independent. You can do your own thing. I don't need to know. And then I found out that my other son said, whatever you want me to do, I'll do it. But having those conversations at the dinner table with your family, it isn't privacy, it's knowing what your history is. You need to ask those questions. When people at funerals, you hear at funerals, so-and-so died of this and so-and-so died of that. That's a good opportunity to have that conversation. And if you're going for testing to the doctor and you have to go in for surgery or things like that, you need to know what your history is. So take that opportunity to say, yeah, my doctor asked me, is there anybody in the family that's had this or anybody that has had that? That's information that you need to know to be able to have a successful surgery. So there are a lot of things that you can do to garner that conversation.
Yes, because we as a race, we are the worst in knowing our history. We do not know anything as far as getting our health. We can say, well, and we don't even know what to call it. We'll say somebody had, their sugar was low instead of saying diabetes. So it's very important that we get our history and know, where we're coming from, not just, for just the sake of, just family history, but knowing for our health reason. And that's why I'm so glad that all of us is here.
So we have 3 really important questions that we want to make sure get answered, but there are a few questions asking about the All of Us research program. So please note, the research program is volunteer-based, meaning anyone can join. Even if you already have a pre-existing health condition, you are actually someone that needs to sign up. The goal is, with 1 million diverse people, you may be in New York, someone else may be in Alabama. You have similar traits in your family. You end up with a condition and the other person doesn't. With the research over that 10-year period, they're able to say, what are the factors that may have contributed to that disease? Or is there a particular lifestyle? Someone mentioned plant-based. So it's a research program, volunteer-based. And once we have Sir Morris Dove and McArath answer these last 3 heart-related questions, Sir Crystal Brown will be sharing slides about how to sign up and also how to get more information about the All of Us program. But it's free and it's volunteer-based. You give the information that you feel comfortable with. But the goal is, as you know, when we get medication, the medicine that we receive is based on what, ladies? A middle-aged white male. If you look around the room and by the names, no one here is a middle-aged white male. But because of the limited research on Blacks, Asian, Latinx, they have to go with what they have. And so all of us is looking through that 10-year study to figure out how to give precise medicine based on what you need on your traits, not the middle-aged white male. So, Sora Banks, I just want to pose these questions and then
I wanted to piggyback on what you were saying about.
Okay, yes, ma'am.
Is that okay?
Yes.
I just wanted to say that it is very, very important as far as research is concerned. I was just in the research study for the Johnson & Johnson COVID vaccine trial. And there were a lot of different informational meetings that went around. And I feel proud to say that I was part of that research that made sure that that goes forward to being approved. So it's also the fact that you can be a part of history and making history better for us as a people. So I just wanted to share that.
Absolutely. And so one of the questions, which is very important, it says, can you elaborate on the importance of cholesterol?
The importance of it? It is cholesterol, as far as all your other blood levels, are very important. Cholesterol, having high cholesterol puts plaque in your heart, which causes it to be congested and it leads to heart disease. So yes, it's very important to know what your levels are because it affects your heart. So yeah, it's important.
The next question says, how do you feel about blood thinners? And if you change your health, can a person be taken off of blood thinners?
Depends on what the medical condition is.
Exactly.
All right. And then it looks like someone says, hello, after coming off a period of inactivity and looking to become more active, how long does it take to condition, strengthen the heart if consistent with exercise?
Well, the recommendation is to walk at least 150 minutes a week, which is pretty much 30 minutes a day. So just that you would take your time, you know what you can do. You can do 30 minutes and break them down into 10-minute intervals. So you know your body, you know how you feel, you shouldn't overdo it. But any type of movement is very important.
And I wanted to add to that too. It depends on you, what type of exercise you want to do. You know, some people can lift weights, some people are in aerobics, some people walk, some people run. What is comfortable for you to go into becoming more active? I tried to be a runner. I wanted to run a marathon, and I went from couch to 5K. I didn't make it. After 5 minutes of walking, and then you have to run for a period of time, to increase your stamina. And then, you got the little pain in the back of your legs, and they say that that'll go away. I said, that's not for me, but I do walk. So you have to find whatever pace is good for you and what's good for you in moving into the type of exercise you want. When you say, Kim, the type of exercise too is
very important, because there are ways to modify the exercises that you choose to do. So if you can't do a push-up, you can do a wall push-up. There is variations in how you do certain things. It's just finding out what's your niche. I'm not a runner, but I love walking.
Me too.
And so one last question related to tonight's topic is, why is it now that you are required to take a cholesterol pill if you have diabetes and high blood pressure?
It's not a requirement. It doesn't come in a package deal. It may be something that the doctor required for that individual person. It could be that the cholesterol was high, along with the blood pressure being high and needing to have a diuretic. And that's why they might have given you a pill that encompasses all of those areas, but everything is personalized to the individual that is being seen.
Yeah, because what it is that all these diseases that was mentioned all has an effect on the heart. People don't look at diabetes, but when you have sugar in your blood where it's not supposed to be in your bloodstream, that is an issue. So I don't know, as far as the cholesterol pill is, the only thing I can think of is because of your cholesterol is the issue, but you have all these other health issues that's going along with it that can contribute to your heart disease.
All right, and there was a question in the chat, but I do think it's important. The person, I was trying to find it, it says, they're a coffee drinker. And so does that impact their heart health?
Yes, coffee has caffeine. Caffeine is an accelerant. It'll cause you to have some, So yes, coffee is, it affects you.
Awesome. And then I think this is it, Sora Brown. Someone is asking, going back to the shirts, with the Zeta Have Heart shirt, is there a Z Hope initiative happening on Friday? Since Friday was mentioned earlier, Sora's want those Z Hope points.
No, but go read the toolkit. No, it's not exactly linked to the wearing the t-shirts. It's more so linked to the toolkit, where because we're not celebrating Heart Month just on that Friday. We're celebrating it the whole month long. So we're asking you to do certain things, and such as cooking, do a heart health class. We can do walking. You can get a virtual walk going on with your chapter or a group of friends, your community. And, you know, donate that money to your heart walk. You can have a panel like we're having one right here. Hey, if y'all on it, you got plenty. I'm talking to my Saras here. If you have enough Saras and a Mikai on here, you can use this as some points. Hey, you already, you're ahead of the game. So it's all about just getting out there and promoting heart health. That's what that toolkit's about. And it's located on our Zeta Have Heart Facebook page under the files.
And I do apologize. She had placed it in the chat, but she just wanted to make sure her question was asked. Wanda said, before having surgery, I had my heart checked. Is this a good suggestion for others? My doctor did it because of my age at the time.
Mm-hmm. I would say yes. Like I mentioned earlier, before I had surgery on my back, I had to be medically cleared. And part of that was an evaluation of my heart function. And they would not schedule my surgery until I had my heart condition corrected. So I had to have a cardiac ablation before I had the actual surgery. If you are going for any type of surgery, you have to advocate for yourself. You know, a lot of times the doctor will say, look, we're gonna do this surgery, but you please ask them to make sure that you are medically clear to be able to have that surgery. I've known people who have gone in to have surgery and then did not make it because of the anesthesia, you know, and they didn't do a full assessment of any allergies that they might have had due to the anesthesia, and they passed away. So you have to advocate for yourself as well. When you go to the doctor, just don't leave all of your stuff in their hands. You want to be able to say, what about this? What about that? So yes, if you're going for surgery, even if you're young, you still should have a medical clearance.
Thank you so much. And thank you for the soror who made sure we answered that question, because that can definitely help someone else. And at this time, we want to thank our awesome presenters for launching this Health is Well series. And so Crystal Brown is going to tell us what's to come and some pertinent information about learning about those target cities for all of us.
All right, again, thank you so much to our presenters. So I want to share 3 of the locations that are currently target areas for all of us, and then I will share 2 upcoming events. One is a part of the current webinar series, and then the next is a event with a local chapter in Boston. So on the screen, you'll see this is for the Atlanta area. Atlanta is one of our target areas. So you see that we have partnerships with Morehouse, Emory, and of course the Veteran Affairs. So this is the contact information, and you can make sure to contact Rashida Wallace. Her email is provided. She is the regional program coordinator. And we will get this information sent out to the registrants. All right, our next one will be Michigan. So as you can see, this is the engagement coordinators. And again, this will be sent out. And then our last one is New York. And again, these are just some of our current target areas. And there will be a training for the members of Zeta. There will be a training taking place later on in the spring. We will send out that information, and that's where we'll go more in depth about all of us and the partnership that we have with Zeta Phi Beta. All right, as far as next events, Delta Omicron Zeta. They will be hosting an event tomorrow on mental health, disparity challenges, and building resilience for adults, youth, and children. This is highly important, especially with the virtual learning atmosphere for our children right now. They are lacking social engagements with their peers, and we do see an increase or a decline more so in their mental health. So this chapter will be working with experts that they are bringing in, several mental health clinicians, psychologists, and a professor of psychiatry, just to discuss those needs for adults, youth, and children. But I definitely think this is something that if you can join, to please join, and I will send this out as well. And then, as we said, this is a series lasting throughout the entire month on each Monday. So next Monday, we will have our mental health. So Zeta Sings the Blues. We will have our mental health directors in addition to a yoga demonstration. So next week's session is To Self with Love. This will be a discussion on self-care and mental health. So we hope that everyone will spread the word, get more people registered, because we have a lot of good information coming your way, and we want to make sure that we are reaching as many people as possible. Again, this is open to the public, so everyone is able to, men, women, children alike, with permission from their parents, they are able to attend these sessions, and we will stream it on YouTube again. Dr. Chambers Williams, did we have another question real quick, or are we just going to save it?
Melanie Bird asked if a meat guy would be able to attend the training in the spring. And so I told her, great question. A meat guy and Zetas will be able to be trained for all of us. And so that's all the questions. We just have the closing video at this time.
All right, so we have a testimonial from a young lady who did and is participating in the All of Us research study. So we're going to show her testimony video. And for those that did not complete the post survey, please complete that. We will put it in the chat again. And thank you again to our panelists, and thank you again to everyone for joining us tonight.
Well, I think that what's unique and important about the All of Us research program is that, you know, there are treatments and medications that don't work for everyone. And this program is really trying to find out why. They're looking into lifestyle, your environment, your genetics to get that answer. And I think that that's important. Personally, I wanted to become a participant in this program and be involved because as a Black person living in America, I know that we've been left out of biomedical research largely in the past. And this program is also looking to change that, and they're looking at more diverse populations. I would say to anyone who has reservations about joining that you could possibly be a part of medical breakthroughs in the future. Why would you not want to be a part of that? I'm Chantel, and I joined for all of us.
Again, thank you to everyone and have a good night.